Hello, my name is Lori, and I'm here to present a proposed policy to the legislator and advocate that the legislator vote for this policy. Accidental drug overdose deaths are now one of the leading causes of death in the United States. Many times, these deaths are preventable if help is called for immediately. However, the fear of going to jail for drugs is a main reason help is not called for. According to the CDC, since 2000, the rate of deaths from drug overdoses has increased 137%, including a 200% increase in the rate of overdose deaths involving opioids, pain relievers, and heroin. The American Journal of Public Health suggests millennials, 20 to 30 years old, are being affected more than any other age group. On the other hand, older folks, known as baby boomers, are more likely to overdose on heroin and prescription painkillers. This is an epidemic. Because this epidemic affects such a wide age range, it infects entire families' systems. This causes unique family challenges, and each family has a different solution. This causes a relationship between individual addictions and the functioning of a family unit. Therefore, because addiction affects an entire family mentally, emotionally, psychologically, and spiritually, it can create imbalance and breakdown of the family unit. Addiction influences a family's psychological well-being, their physical health, and family finances. Because different members of a family play various roles in the family unit, when there are unhealthy patterns of behavior, those behaviors can carry over into adulthood. This impact affects children more than any other family member and, unfortunately, can be taken into adulthood with them. It can lead to fear of abandonment, loneliness, anxiety, feelings of helplessness, a poor self-image, among other debilitating behaviors. Due to this epidemic, many grandchildren are being raised by their grandparents, which brings a whole new set of dynamics to the family unit. A primary cause is due to addictions and mental health disorders. Inasmuch as substance use disorders not only put individuals in a position for an overdose, it also puts families in crisis situations. Often, unhealthy interpersonal problems are the result for each family member. There is conflict with children, partners, and antagonistic health perils. In turn, this results in problems with economic possibility and impacts on employment for families who are victims of opioid crisis, which in turn impacts both families and communities. There are many resulting problems such as sexually transmitted disease, otherwise known as STDs, teenage pregnancy, child abuse, physical fights, domestic violence, motor vehicle crashes, and crime, which include homicide and suicide. These important issues make opioid addiction and overdoses of utmost importance to address. The need for recovery and treatment programs is significant with drug standby and preservation rehab plans. The need for life-saving salvage medication such as naloxone or a comparable drug to reverse drug overdose is needed to help give these families hope and look forward to a future. Without this type of a plan in place, these situations not only affect individual families, but will continue to affect our communities and hinder a sustainable society. Moreover, because there has been an increased amount of deaths experienced by families, they are getting involved in doing something to prevent these tragedies. A group of parents whose children died of drug overdoses collaborated to pass a law to permit greater use of naloxone to reverse drug overdoses. This is called Moms United and mandated to saving the lives of drug users, Moms DU. To lower the amount of overdose deaths, public health administrators provide backing with comprehensive action across multiple perspectives on the issue. The plans that have been developed to address the opioid crisis have been expanding access to treatment, encourage naloxone distribution, and act against clinics and physicians who break the law. In addition, educating the public about the risks of addiction. Because the risk of addiction and ultimately overdose deaths by addiction, it is important to implement an action plan and policy to enhance healing and a higher quality of life. To combat this problem, the CDC has launched a prescription drug overdose prevention program. This initiative is part of the U.S. Department of Health and Human Services Opioid Initiative. Its goal is to equip and implement an injury prevention program. One of those outcomes is the implementation of naloxone dispersal to police departments, health agencies, and families to prevent the overwhelming amount of deaths by way of opioid addiction. Therefore, children, families, police departments, legislators, and healthcare agencies will be affected by this policy addressing the health issue through prevention programs, including rehab centers to educate and offer alternative solutions to the root causes for addiction. Accordingly, not only are sickness and death rates connected with prescription drugs a top public health concern, but the costs forced on the U.S. economy are also considerable. In studies that have been done, the use of non-prescription painkillers has imposed astronomical costs on the U.S. economy. As well, the amount of lost productivity has seen a significant problem. Increased criminal court costs have taken their toll due to the issue. There have been billions spent on drug abuse treatment. Consequently, providing naloxone to those who use opioids, their caretakers, family, and friends, is cost-effective and preventative. It not only saves lives, but saves money as well. CDC funding helps war against prescription drug overdoses. It improves prescription drug monitoring programs and encourages education of providers and patients about prescription drug overdose risks. Reversing the epidemic crisis will require programs in all 50 states. The risks of not enacting this policy to provide naloxone to families and caretakers of those who are drug addicted can be substantial. As explained earlier, we have many agencies who are making addressing the opioid crisis a priority. This includes focus that includes evidence-informed initiatives such as increased naloxone use, notifying practices that advise opioids, and helping addicts work through medication-assisted treatment to conquer their addiction. This entails significant investments to strengthen efforts to diminish the misappropriation and mishandling of opioids. By making these initiatives a priority, we can lessen the financial blow this epidemic has on our U.S. economy. This includes but is not limited to healthcare costs, criminal justice costs, and losses from Americans who are drug dependent leaving the workforce. Many people's lives will be affected by the health issue change if the policy is enacted. The healthcare workers, patients, and their families, government officials, and police departments, all these facilities are connected to an addict in one form or another. When these agents are educated and taught how to administer the naloxone properly, the cost of addiction and the death rates will be significantly reduced. Furthermore, when treatment programs are put in place, the patients can learn healthy coping mechanism skills and become strong enough contributors of society to help create a sustainable future. Whether conservative, moderate, liberal, or progressive, most likely every person has a family member or friend who has suffered with someone they love struggling with drug addiction. However, there are some people who do not have an understanding of this issue and may not have a family member or friend who has suffered the devastating effects of this disease. Whether we have someone who suffers from this disease or not, we each have something at stake when it comes to addiction, and that is the sustainability of our future, not only for us, but our children and our grandchildren. Because this drug addiction disease is a universal issue and so many suffer from it, causing us to live ineffective lives, then this information will potentially affect the voting behaviors for everyone, not just a selected few. We experience death of our friends and family through drug-related care accidents and gun incidents. It impacts our entire livelihoods, and these are some of the most important messages that legislators need to hear about this policy. This epidemic is so large and crushing and affects such a high percentage of our population that we either know someone personally or far removed being assaulted by this epidemic. If we're ever against this policy, it could easily change if we experienced it one day with our own child. In conclusion, if anyone is not in favor with this policy, let's review some important points that affect the American policy. This epidemic has burdened our country with a crushing financial toll, which has burdened our total income, healthcare costs, criminal justice costs, and the amount of jobs lost due to drug-dependent Americans leaving the workforce. We can remedy this issue by empowering physicians through education, policies, and procedures to assist patients in setting up appropriate treatment and set healthy recovery goals. Thank you.